Hello, and thanks for joining us in our Parent Series. My name is Ashley Truman Scavor, and I'm a prevention educator with the Licata Way. We are a nonprofit organization here in Lorain County, and our mission is to keep our youth drug and alcohol free, especially during this time of uncertainty. The districts that I mainly work in are Avon Local Schools and Keystone Local Schools. I am a wife and also a mother of two. I have a 12-year-old stepdaughter, and also I have an 8-year-old son. Today, I would like to discuss a topic of including our children in the discussion. How do we do that? Things look very different, especially with starting a new school year. So discussing things such as face masks and socially distancing, also hand washing and sports during this pandemic are going to be huge when we discuss these with our child. So as we continue through, I'm going to hopefully give you some tips on how to do that. This toolkit is going to be full of resources for you in order to help you through some times that you may face as a parent with your child in COVID-19. Please feel free to use any links or videos that you see in this presentation. We have put this whole series together for you as a parent. So these are tools for you to utilize. The first topic that we should talk about is face masks. Going back into the schools, the kids are going to have to wear face masks. I know my kids, our district that we are in person 5 days a week. And we start next week. And we will be wearing face masks. So the conversation in my household has been, why are they important? Why do I need to wear them? But they're uncomfortable, Mom. I don't like them. We've really been practicing together as a team in wearing masks. And I've been answering any questions that my children have, knowing that my children are going to have a tough time wearing them. So when I answer these questions that kids might have, it's important that, we answer with simple words to explain why they're so important. And also allowing that child time to process the new things, the new protocols, the new mandates. School is going to look very different. Our district has done an amazing job at putting videos out. And I have in return shown my kids what school is going to look like, really just including them step by step in what is asked of them. Attached, I have put a link to kidshealth.org. This is a very great article. It gives insight to how we can help our children in modeling what we would like them to do. I also have a short video. It's about 1 minute and 15 seconds, and I will play it for you. And it's guided towards the younger children. It's a visual tool. Sometimes our kids just need to see it. So I'll play that for you. Feel free to use it if you would like.
You may be seeing a lot of people wearing masks lately and wondering why. Masks are here to help us. They help prevent the spread of some germs from person to person. People wear them to keep each other safe and healthy. People like nurses and doctors.
Underneath my mask, I wear a smile.
My mask helps me take care of you.
Or your family and friends.
We wear masks because we care about you.
Think of your mask like a superhero cape. It helps you save others from getting sick by protecting them from the spread of some germs and viruses. Animals protect themselves too, like a porcupine with its sharp quills or a turtle with its hard shell. When you wear your mask, make sure it covers both your mouth and nose. Once your mask is on, try not to touch it with your hands. So remember, masks are here to help us. If we all wear them, we can stay safe and healthy. Be a masked hero with Cincinnati Children's.
I hope that you find that that video can be useful for you. Our next topic is going to hand washing. Hand washing has always been important, but it's especially important now because of the COVID-19. So when should we wash? Well, we should wash before eating or preparing our food, before touching your face, after using the restroom, after leaving a public place, after blowing your nose, coughing, or sneezing, after caring for someone sick, after touching animals or pets. And also we want our kids to avoid touching their eyes, their nose, and their mouth with unwashed hands. The most important one, I think, on this list, because we teach our children to wash our hands, but washing our hands after handling your mask, I know as a parent, this is going to be difficult for my children to do because we are constantly touching our face. So once they touch their mask, the rule is to wash their hands. Well, what if there isn't a sink close or nearby to them? So what I did on my kids' book bags is I put the pocket hand sanitizers in the little holder on them. So if they do touch their mask or touch their eyes, nose, mouth, whatever it may be, because they're kids and things are going to happen, they're at least able to sanitize their hands, because our district is also, like many others, there are no lockers this year, so they will have their book bags at all times. So that hand sanitizer will be with him. I do have another video. It's about a minute long, and it does, again, is a visual for showing our young adolescents how important it is to wash their hands. I want to stress, this isn't just about our younger children. Our older children, our high schoolers, our seniors, they need reminders to wash their hands or sanitize their hands as well.
Did you know that sometimes when people get sick, it's because of tiny things called germs? Not all tiny things are bad, but some germs can hurt people. If you've heard someone say they have the flu, a bug, or a cold, it could have been caused by germs. The good news is you can help stop germs from spreading. Wash your hands regularly, since germs can get on hands and be spread around. After using the bathroom or getting your hands dirty, wash with soap and water while counting to 20 really slow. Turtle slow. Super cool turtle slow. Cough and sneeze into your elbow. That keeps germs away from your hands and other people. Don't pick your nose, rub your eyes, or touch your mouth, since those are easy places for germs to get into your body. The less you put your hands on your face, the better. Germs like to hide on surfaces like countertops, door handles, and cell phones. Do your part to keep them from spreading by wiping down surfaces and keeping your hands clean. Germs are a natural part of life. Simple things like washing your hands can keep everyone healthy. A message from Cincinnati Children's.
So when it comes to wearing masks and washing our hands and everything that we've heard in the media and all the protocols going on,
did you know that sometimes
the anxiety of going back to school is extremely high right now? Not only for the parents, but for the children as well. The article that I've linked to this slide, and you can copy and paste it into your browser, or if it might just be a live link from here, I'm not very sure. But what this article talks about is healthy emotional coping during this time. We're all dealing with the anxiety. Many of us on this team are parents as well, and we are sending our children back to school in some capacity. So we have all of those worries just as much as you do. But showing our children a calm, respectful response to the anxiety is going to help them to know that everything is going to be okay. And I want to say that one more time. Everything will be okay. We will get through this. We will make it back to school. Our children will learn. They will be okay. sports during a pandemic. I now have a 7th grade volleyball player. We had one game that looked very different. The CDC is a great resource to help guide that conversation. They have many talking points listed through the link below. And also I have attached the governor's, his recommendations, his protocols. One of those protocols is 15% capacity within the gym. That comes out to 2 parents and the athlete. It's important to know that that creates anxiety for that athlete. My athlete happens to be in a blended family. She has 4 parents. It stresses her to know that not all 4 parents can be there. So us as the adults of her need to reassure her that it's okay and we will all make it to her game eventually. We feel the same way as her and it's okay to be upset. Social distancing or physical distancing, my kids, have a hard time staying within their own bubble. So this will be hard across the board, but know before you go, know who's going to be there, how many people are going to be there. Limit your contact when running errands. I know when I run errands, I either keep, my kids stay with the husband and I go, or my husband goes and I stay with the kids to kind of limit how many people are out. We are keeping distance at events and gatherings, staying distance while being active. Again, back to that sports piece. If they're on the sidelines, they do have to be 6 feet apart and they do need to have their mask on. And again, the CDC has great tips and tools in regards to social distancing. So we talked about social distancing, washing our hands, wearing face masks. You might think, oh, this is great, but how do I start this conversation? We should strive for a sense of calmness. We need to remember that our children are going to react to both what we say and how we say it. So our verbal and nonverbals, those all need to match so we're giving the same message. Reassure children that they are safe. They're going to be safe in their school, but it's okay to be upset. Validate their feelings. Make yourself available to talk and to listen. Put down your phone. I know I am very guilty of doing 5 things at one time, and then a child wants to talk. I need to put down those 5 things and listen to my children. Avoid language that might blame others and lead to stigma. Pay attention to what your child sees or hears on the TV, radio, or online. Social media is a big piece right now in, our information, and if it's truthful, if it's appropriate for their age and the developmental level of the child. In our household, we have had many conversations in regards to going back to school, the guidelines, how all of that is gonna look. I've really included my children in the conversation. But my conversation with my 12-year-old is going to sound a little different than my conversation with my 8-year-old because I'm using language that my 8-year-old will understand. My 12-year-old can comprehend a little bit higher material. Teach children everyday actions to reduce the spread of germs. We've been practicing wearing our masks. We've been using hand sanitizer in my house. Washing our hands for at least 20 seconds. And then, of course, if school's open, which at some capacity they will be open, like I said, our district is 5 days every day. So what we've been doing is, again, I've been showing them the videos that our district has been putting up on social media so they know what the school looks like. Our building plans came out. I read them to my children so they knew what was going to be expected of them. Please find all of my resources here. A lot of them are CDC. The CDC has great information. all of the videos that I used are for the CincinnatiChildren's.org. They have other videos that you might find useful. I do hope that this information helped you process things a little bit different and gave you some tips on how to start the conversation. We are all hoping for a great school year. If you have any questions, if you need any of the information that I gave, or you would like more information, please contact our prevention staff at 440-989-4900. Again, I hope you enjoyed this presentation, and stay tuned because in the weeks to come, there's going to be a lot more. Thank you.